My name is Sherri Moultrie with the University of Alabama at Birmingham. I provide disability management services for the university and hospital, and I have someone that will be joining me today to have a discussion. This individual is an employee, and this individual has been diagnosed recently with cancer. I'm going to help her just navigate the system, answer any questions that she may have about continuing to maintain her employment while going through her treatment. Hi, Allison. Thank you so much for coming in today. How can I help you?
Well, I appreciate you seeing me today. I've just gotten some bad news. I've been diagnosed with breast cancer, and I'd like to try to continue working through my diagnosis and my treatments, and I'm just not really sure where to start. I've written some notes down just to remind me of what I needed to ask you about as I've been talking to other people, and the first thing that I learned about was the Americans with Disabilities Act, but I really don't know what it is. I've heard it can help. Can you give me a little information about that?
Sure, Allison, you're certainly right. I've worked with many people that have continued to work through their treatment and been a resource here to provide information about different things that they could look at. And the ADA is definitely a comprehensive civil rights act that really is critical, something that I think you really should know about, just in terms of considering to maintain your employment here. And basically, it does provide protections to individuals going through cancer. And basically, if a person, the ADA is going to define an individual with a disability as a person that has some physical or mental impairment which substantially limits their major life activities. And by the major life activities, that could be working, performing manual tasks, hearing and seeing, and so forth. So there are many different major life activities that would be included. So the first thing is that you have to have that substantial limitation. And then we're looking at a person that has been regarded as having such a condition, or a person that has a record of such condition. So those are some of the things that we look at. And the ADA would apply to employers that have 15 or more employees. So even, you know, if you continue to work and you need some sort of reasonable accommodation in the workplace, you would still have to be qualified for your position. So you would still have to be able to provide the essential functions of your job with or without accommodations.
So that includes someone with a cancer diagnosis. Are there any kind of restrictions or anything I need to think about? Do I have to work a certain amount of hours or anything like that?
Well, basically, when it comes to the Americans with Disabilities Act, there's the ADA Amendments Act of 2008, and that really kind of broadened and expanded the law to include more individuals. So before, there was an extensive type of evaluation that kind of had to be done, or employers would kind of really be looking at how the person was impacted and major life activities and so forth. But now individuals with cancer, it's more clearly cut, just in terms of having more people be able to receive that coverage under the ADA. So when it comes to working a certain amount of hours, you mentioned, so are you referring to FMLA or?
Maybe that's right. But what is an accommodation? What does that look like? What is that?
And it could look in a variety of different ways. It just kind of depends on, we want to look at what you're doing in your role and what you're having difficulty doing, what type of task you're having difficulty doing. So basically for you, a reasonable accommodation could be put in place to help you be able to remain in the position that you're in and to be able to perform the essential functions of the job. So not so much the more of the marginal type of functions, but more of the critical functions that are essential in what you do here. So we would kind of look at that, but it could be things related to if you need to have time off to be able to go to your treatment. It may be if you're experiencing pain due to your treatment or condition, and may need some accommodations put in place It might be that we need to look at your workstation to see if something needs to be put in place to alleviate some of the pain or some of the symptoms that you're experiencing. So I think there are a wide variety of different things that we can look at in terms of accommodations, restructuring tasks, and doing things like that.
Okay, good. You mentioned family medical leave. I'm concerned that once I start my treatments, I may not feel like coming into the office. So I am concerned about taking time off. Do I take sick time or my vacation time? How do I do that?
Okay. Well, as an employee with cancer, you might definitely want to look at the Family Medical Leave Act.
Oh, okay.
You would start with really kind of talking to your doctor, and your doctor could provide some sort of certification indicating that you have a need to be out, a medical need to be out. But it is protections that are available to you. So basically, you would be able to receive up to 12 weeks time off from work, and that would be protected leave.
Okay. So
Off.
it's
So you
unpaid.
could use, it is unpaid, but you could use your sick time and your vacation time, your PTO time to be able to apply.
Okay, good. Well, good.
So, and then if you get to a situation where you've used up all of that time, some employers even have donated sick time and things of that nature.
That's good to know.
And different organizations there where you can further inquire to see if that would be helpful for you.
Okay.
Now, there are some requirements that need to be met with FMLA.
Okay.
And you have to work for your employer for at least 12 months. And in working those 12 months, be able to have 1,250 hours logged as well. And that would apply to employers that have 50 or more employees.
Okay, so that 1,250 hours worked, is that in the month prior or is that in the last 12 months? How long a time period is that?
Right, and that would be within the time prior to you going out on that leave.
Okay,
Yes,
good.
ma'am.
Well, that clarifies it for me.
But even if you're in a situation where you're not eligible for FMLA, you know, you could still talk to your employer to see if there's some sort of accommodation that could be made in the process of leave.
Okay.
So you could request that type of accommodation to kind of help you even if you're not eligible for the FMLA.
Okay. Well, that's good to know.
If you don't meet those,
Yeah.
the criteria that's in
Okay.
place for there.
That's good to know. I do probably, I may not remember, everything we've talked about. Are there places where I can get more information?
Yes, certainly. So I've actually provided a list
Oh,
of
great.
resources that I have available. As I've mentioned before, I do speak with
Great.
individuals that, have recently been diagnosed or those that are going to be starting a different round of treatment. So
Okay.
I do have some resources that are available where you can go online to read more information about FMLA, facts about Americans with the Disabilities Act.
Okay.
There are also some community resources that are out there and
Great.
available.
Yeah.
The Job Accommodation Network is a great resource that's out there for you as a patient, but also for your employer.
Okay.
So if your employer wanted to know a little bit more information about how they can accommodate you, there are series that they have out there of information that would offer some suggestions for actually accommodating a person going through treatment
Great.
or a person that's been recently diagnosed with cancer.
Good.
So that's an excellent resource. There's also the Alabama Department of Rehab Services. They're
Okay.
located in every county in Alabama.
Oh, okay.
And they help individuals with disabilities find employment or even retain their employment. So
Okay.
they have a specialized unit that works focused on helping individuals and has relationships with employers
Oh, nice.
in the state.
Wonderful.
So that would be a great comprehensive service that would be available too.
Okay.
They have eligibility requirements, but of course, you can talk to the counselors there to get more information.
Okay. All right. Well, great. Well, thank you so much. I feel so much better now, and I really appreciate you taking time.
To know that there are resources out there to help you,
Okay.
internal resources here in our organization.
Okay.
And I really recommend that employees really kind of find out what's available through their particular employer.
Okay.
Because there might be some resources. There's the counseling center that might be available.
Okay.
And that would be a good resource.
yeah,
Not only
absolutely.
your hospital and your doctor's office They may have social workers and counselors that work
Okay,
there, but
good.
here, within our organization, we also have that resource.
Great.
So there are many resources out there, and a lot of
Good.
people do maintain their employment while they're going through treatment. And I think generally employers, really want to help their employees and want to be supportive. Sometimes they might not know exactly what types of things are needed, but I think it is an interactive process. If something is needed, your employer will engage you in the interactive process, where it's more of a dialogue that you all sit down and maybe involve human resources and just kind of talk about the things that are needed.
Great.
The decision to disclose your disability or your condition is entirely up to you, but if there are going to be things that you need in the work environment, to be away from work, maybe some sort of modifications, changes to schedules, different things like that, then you may have to disclose, a certain amount of information, which will be required, and maybe some documentation as well from your physician to show that it's medically necessary to have some things done. But there are a lot of options out there and a lot of things that are available, so please do know that we're a resource here, and if you have any questions, you can certainly always get in contact with me.
Thank you. It's been a huge relief, and I appreciate the good advice on talking to my manager. They'll be a great support system for me.
I'm sure they will, and
Thank
if you share tasks with someone at work, you might also want to kind of think about, does that person need to know?
Okay.
And you may have some great options and great ideas to share with your employer too about how things might be able to be done differently for a short period of time while you're going through treatment. Telecommuting might be an option for you. So I think there are a lot of different things that we can explore.
Great.
So I hope you've have more knowledge.
Thank you. I do. And I feel so much better.
had.
Appreciate it. Thank you.
No problem. Thanks so much for coming in. We've discussed a lot of important information today. I want to remind you of a few important points to take away. The Americans with Disabilities Act, ADA, is a comprehensive civil rights law that helps protect the rights of people with disabilities in employment and other areas. The ADA does apply to employers with 15 or more employees. Reasonable accommodation is how an employer makes adjustments to a job that allow an individual employee with a disability to perform the essential functions of that job. The Family Medical Leave Act, also known as FMLA, allows eligible employees to take up to 12 work weeks of unpaid, job-protected leave for serious health conditions. Become familiar with the policies, benefits, and services available to employees. For more information, you can visit any of the websites on your screen.